Schizophrenia is obviously a very difficult condition to treat, and a lot of the existing drugs come with some debilitating side effects like weight gain, things of that nature. Are there any new treatments on the horizon that kind of can handle some of the other symptoms that go with schizophrenia and treat patients?
Well, I can't think right off the top of my head what the name of it is. And I'm not, I think it's in final phase trials. There's going to be a Zyprexa coming out, an olanzapine coming out that has a molecule added onto it that is supposed to make it more metabolically friendly for use. Olanzapine is actually a pretty great antipsychotic, but it comes along with it with almost assured weight gain and high cholesterol and elevated glucose and things of that nature. So I just recently saw an update about it, and I believe that what I saw was that it was in its final phases. I'm not sure if it's gotten FDA approval yet or not.
Okay.
So yeah, there is something. In the meantime, we do other things. I mean, I add metformin if people are having, lots of weight gain and things like that. I mean, there are ways to manage it with, added medications, but that's the only single pill that is an antipsychotic that is supposed to have something in combination to address the metabolic side effects.
Okay. Now, what makes this patient population more difficult to treat than some of the other psych conditions?
Oh goodness, let's. How many would you like me to name? So, age of onset is often pretty young. That presents its own problems, right? We don't necessarily, if we're 15 or 18 or 23 years old, you don't look like you're very old, but you probably are more than 23. But if you think back to when you were 15, 18, or 23 years old, your insight wasn't necessarily very good about the importance of taking care of yourself, the importance of listening to medical professionals and whatever advice they're giving you or recommendations they're giving you. And then to hear at that age that you have such a serious illness that has such a stigma attached to it, to think that you're going to be labeled as crazy for the rest of your life. Parents often have a very difficult time accepting the diagnosis as well. And so when there's not, parent or guardian support or buy-in, that adds to the challenge. So that's one. Early age of onset when there's poor insight at that age anyway. The illness itself tends to bring on poor insight for individuals. So it's kind of this additive effect sort of a thing. But, the fact that we have to use medication to treat it, there's often a negative attitude toward medication in general. They've heard stories, or they've seen things on TV, or they've seen things on the internet, or whatever. And so there can be a very negative attitude toward medication. Often, especially if they're hostile when they have their first psychotic break, if they end up in an inpatient setting, they're often very, very heavily medicated just to calm them down. And so then they don't like the side effects of the medication. And so that adds to a negative view of medication treatment. I could go on and on about lots of personal opinions about some other things. I think sometimes there's not a real interest in building a relationship with these individuals from a provider standpoint. And so building that rapport, building that trust so that, you can get them to understand that you do care and you do want them to have a successful life, and this is why you're offering treatment and the treatments that you're offering. I think historically, I think that's getting better. I think that's improving, but I think historically that has been a pretty significant barrier. Sometimes their symptoms themselves are problems. They're delusional. Their delusions are that they might be paranoid in nature, and so medication might be poisoned, or I might have some ulterior motive and I'm not really there to help them. So sometimes their symptoms can get in the way, or their delusions might even be very grandiose. I recall very distinctly when I worked in an inpatient setting, a young man who was on my stabilization unit who thought that he was placed there by the CIA as a test, so that if he were ever captured as part of his great mission, he would know how to get out. And he spent his first 5 days making very serious attempts to elope the unit, to escape the unit, because he thought that was part of his training while he was there. And so trying to get them to, you know, to get out of their delusions and join us in a rational world can be challenging. Medications have side effects that often aren't tolerable, even if they aren't being over medicated. And people complain about feeling numb, or the word they often use is zombified, right? They don't want to feel zombified. They want to feel like a human being. And so I think that this is getting better with newer medications that we have. Second generation antipsychotics in particular are much more tolerable from a sedation side effect standpoint, but also from a metabolic standpoint as a whole.